welcome to SVG-TV's news for Thursday, April the 23rd, 2020. I am Bhavin there with the details. More than 5 persons were reportedly identified to have been in contact with SVG's most recent COVID-19 case, which health officials say is a possible local transmission. The Ministry of Health said investigations are continuing into the case, which was confirmed 2 days ago, Tuesday, April 21st, 2020. At a news conference today, Chief Medical Officer Dr. Simone Kieser-Beach was asked whether patient 13, the latest confirmed case, might have been in contact with an imported COVID-19 patient, to which she replied they are treating it as a possibility.
We have to remember in terms of confidentiality, and we have identified some possible sources. Okay, I would say that we have identified some possible sources, but until we have more definitive, even as we recognize that sometimes you never will have a specific source, a clearly identified source, we have identified some possible areas of possible contact. And you say I'm saying possible this often because we are currently in this investigation.
Dr. Kieser-Beach said contact tracing guidelines are being followed into the possible local transmission case.
Importance of contact tracing is even greater here because you are trying to identify who and where you should be guided. It's not a blind science. It is based on where the person might have been, what are their contacts, what are their possible exposures. Even as we do that, and even before this, our strategy in terms of surveillance has been looking for any cases wherever they might be in St. Vincent.
Minister of Health Luke Brown said overall the COVID-19 cases have been mild and gave an update on the latest figures in SVG.
This was our first case since Thursday, April 9th, 2020, the day before Good Friday. We had a period of 12 days without new cases. The health professionals continue to monitor the situation with vigilance and carry out surveillance activities. This takes us into a treatment of the numbers. Overall, 101 persons have been tested by the last report. There are 13 confirmed cases, 88 negative results, 4 recoveries, no deaths, only mild cases, and 9 active cases.
Minister of Health Luke Brown said that in-country testing of COVID-19 is likely to commence next week if there are no further hiccups with the arrival of the PCR testing equipment. The PCR testing equipment was reportedly delayed due to U.S. border issues.
That certainly by sometime next week we might be in a position to have our own machine, our own PCR machine in St. Vincent and the Grenadines, and start testing even after you factor in a period of training. So perhaps within a week's time or so, we would be able to commence testing locally in St. Vincent and the Grenadines if everything goes according to plan.
SVG received 3,000 rapid testing kits. However, they will not be used to diagnose COVID-19 patients. The Ministry of Health says so far no one has been tested with these rapid test kits, as they are still awaiting protocols to do so. CARF in Trinidad and Tobago continues to be the institution conducting COVID-19 testing for SVG. Center in Argyle is expected to become fully operational next week. At today's media conference, the Health Ministry said the facility has to be inspected and furnished with the relevant medical equipment and supplies. Minister Brown said that the operation of the facility will put health practitioners in a better position to manage any severe case of COVID-19.
This is very important should we find ourselves in a situation where a patient with a severe form of COVID-19 has to be hospitalized and receive special support. You would remember that the staff for this isolation center will consist of the Cuban Brigade, and a local complement of health professionals and ancillary workers. We also have isolation capacity at other health facilities and using mobile units.
The government has also procured 2 facilities for public quarantine. 2 persons were recently placed in public quarantine during the period when there were more than 400 persons in self-quarantine. However, presently no one is reportedly in public quarantine. Today, however, the health minister reported that the public quarantine facilities will be used for the Vincentian sailors, who are expected to return home sometime next week.
The matter of quarantine is significant in light of the arrangements being made for the return of Vincentian workers on cruise ships, the return of Vincentians abroad, other Vincentians abroad, because we have some persons who live here who are abroad right now, and in general, the resumption of regional and international flights. The COVID-19 task force has already presented protocols to guide the repatriation of Vincentian cruise ship workers and other Vincentians who are in foreign countries. The safe transfer of these persons is a massive operation that has to be carefully managed.
And Chief Medical Officer Dr. Simone Kizabich today sought to explain her position on border closures in light of the threat of COVID-19. She said while the closing of borders will protect citizens for a period of time, at some point the borders will have to open up and the threat of COVID-19 will still remain. Hence, she did not advise the authorities to close the country's borders.
But as you protect your population, that is what we will call a virgin population, an unexposed population. And when you reopen, what you were keeping out will come into that same population. So my position has always been controlling the process, giving us time to slow, but also recognizing that always recognize that this, unless we are going to stay closed until there is a vaccine, and that might be 18 months. And then once there's a vaccine, the entire country, we have a massive vaccination program. Unless you're going to do that, the belief that you can close and forever protect your population, I think, is an error. Rather, we have control and we understand what's coming.
The CMO said that persons have to learn to live with COVID-19, noting that whether borders are closed or not, the disease will still find its way into the country, and strongly believes that containing the COVID-19 is possible with other stringent preventative measures.
Whether that is strengthening our surveillance, whether that is strengthening our capacity to quickly isolate, quarantine, manage, that has to be your focus. You build that capacity rather than assuming that you can forever prevent something that will come.
At a previously held media conference, the CMO stated that the closing of borders was one way of containing COVID-19. While some banks have reduced their working hours due to the threat of COVID-19, PM Gonzalez asked that they reconsider such action.
Entirely opposed to the shortening of hours at the bank. In fact, the Minister of Finance has explicitly indicated, as far as I personally know, to at least one bank, and I've been advised that not necessarily the Minister of Finance, but other officials in the Ministry of Finance have said, look, just like what Kenton asked about what sense does it make, you know, and I know that is a matter which we'd like to see reconsidered.
The Prime Minister said the scaling down of hours will be looked into, noting that when implementing measures, one has to ensure that they are carefully crafted.
Similarly, one of the things which we have to watch as a practical matter And I think the longer this goes on, the more that persons are seeing that the approach of the government is to drill down on a lot of very practical things. As I say, not to use a chainsaw where a scalpel might be more appropriate. Even when good facilities are provided outside, and the Bank of St. Vincent has done that, put up tents for persons who you take in a certain number of persons. We have to be careful that we don't transfer the problem from inside the bank.
And we have some breaking news. According to a release from the Ministry of Health, St. Vincent and Grenadines has recorded its 14th positive COVID-19 case. Today's new case closely associated with the one which was reported on Tuesday, April the 21st by the Caribbean Public Health Agency, CARPHA. The first case since April 9th, 2020. Chief Medical Officer Dr. Simon Beach says investigations on these cases are continuing and have been productive thus far. However, it is still too early to issue a definitive statement on the source of the infections. On Wednesday, April 22nd, results received medically cleared a fourth COVID-19 positive person, meaning that the individual is no longer exhibiting signs of the virus and has now recovered. The latest results, Thursday, April 23rd, received from CARPHA also indicate that another individual has received medical clearance. 5 persons have therefore recovered from COVID-19 in St. Vincent and Grenadines. This means there is now 9 active cases of COVID-19 in St. Vincent and Grenadines. 8 other persons who had samples tested at CARPHA over the last 48 hours as part of ongoing COVID-19 surveillance were negative. To date, samples of 108 persons have been collected for PCR testing at CARPHA. Dr. Beach is reminding the public about the importance of maintaining the public health measures currently in place, which include hand hygiene, cough etiquette, physical distancing, at least 3 to 6 feet in public spaces, and strict adherence to quarantine and isolation. These measures, Dr. Beach maintains, are vital if we are to continue to slow the spread of COVID-19 in St. Vincent and the Grenadines. And continuing, Director of the Pan-Caribbean Partnership Against HIV and AIDS, Vincentian Dr. Rosamond Adams, believes public health measures to tackle the spread of COVID-19 can be a step back for HIV/AIDS patients' ability to access health care. Speaking via a virtual interview with the National Communications Network News in Guyana, Dr. Adams said while people are living with HIV/AIDS are at risk of contracting COVID-19, limited access to care and treatment in the present circumstances can pose a challenge.
Also, when you look at measures such as quarantine and curfews being put in place, it means that our work hours where we can really do work have been reduced significantly. And so even when we try to work at home to readjust, it is just not the same in terms of having the person-to-person relationship, working relationship, where we can push to implement a number of projects and a number of activities.
Dr. Adams believes a new policy directing among public health agencies and civil society organizations in the region is needed to preserve the work done against HIV/AIDS.
We have to push for ways in order to work around these measures that have been these public health measures that have been instituted. So we may have to look at, say, multi-month prescription instead of going every month, that someone who has to get medication.
The PANCAP director also recognized that there is stigma and discrimination attached to persons affected with COVID-19 and called for the behavior of those to cease, noting that the experiences learned from HIV/AIDS pandemic can be applied to the fight against COVID-19.
The way in which HIV have tackled this is that there need to be community-led interventions that tackle the issues of stigma and discrimination, to really interrogate where are these issues coming from and how best that we can really solve the root problems of stigma and discrimination. Is it, around the disease because the disease is a pandemic? Is it because, of the mortality caused, or is it because of say, complications of the disease?
PANCAP, which headquarters is in Guyana, was established by CARICOM heads of government in February 2001 in response to the threat of HIV to sustainable human development. It provides a structured and unified approach to the region's response to the HIV epidemic. Meanwhile, foot health care practitioner in the Ministry of Health, Sister Janice Oliver Crease, is advising persons with diabetes and hypertension to avoid panicking and stress during the COVID-19 pandemic. In an interview with SVG-TV News, Sister Crease said that though hypertensive diabetic patients have been listed among the risks for contracting COVID-19, there is nothing to be fearful about, noting that the stress further increases the glucose level and raises blood pressure, which could be detrimental to their health.
Of themselves, knowing that changes in lifestyle, stress, and illness can impact glucose level in all sorts of ways. Because if you're stressed out, being that we are in the coronavirus season, if you are stressed out, it can affect your glucose level. So try as best to remain calm. Usually glucose level will go up and sometimes goes low. So it is important to be mindful of these things. So you are to remember that you need to monitor your blood glucose level and adjust it as needed to keep your blood glucose level within the normal range. Therefore, as healthcare providers, we need to be sure that our patients and our clients are stocked with medication they need, and to make readily available where they can access some review so that they can know how the diabetes is going with them.
Sister Crease said it may be difficult to reach healthcare providers at this time and encouraged persons who can try to purchase a blood glucose machine, test strips and other equipment to keep monitoring their current illness.
A blood glucose machine and test strips at home so that they can test their blood glucose level if they become ill. It would be nice if medication can also be picked up by relatives from health centers or pharmacies so that patients can avoid crowding at health centers or pharmacies to get their medication, because we are trying our best to maintain the physical distance and the social distance. It would also be good that that our diabetics, we avoid, this hugging and kissing, and you avoid crowded places. You are to be alert. Make sure you be alert, managing your diabetes. This is important to you right now, managing your diabetes.
The Foot Health practitioner said it is equally important at this time for diabetics and hypertensive patients to stay at home, continue to practice good hygiene, and follow all guidelines set out by the health authorities. And members of the Royal St. Vincent and Grenadines Police Force, family and friends bid farewell to Police Constable Daniel Daisy, who passed away on April the 11th. The beloved police constable was accorded a full military funeral. However, efforts were being made to ensure that social distancing protocols by the Ministry of Health to curb the spread of the novel coronavirus was adhered to. Speaking at the funeral service at the Methodist Church, Commissioner of Police Colin John said that his first encounter with Constable Davy was when she joined the organization in 2003. He said she was always hardworking and dedicated member of the RSVG police force.
The opinion that the Almighty Father needed a special Daisy in his garden, and he has since transplanted her to that celestial garden. Daisy was very dedicated to the organization. She went above and beyond the call of duty. She always lit us up with her smile. God has taken her with him. We cherish our fragrance and our memories. One wish of Sergeant Rodney is that our tenure at Telecom helped to bring cooperation and more cooperation to that department, and that we live the Daisy legacy.
Commissioner John said those who worked along with Constable Davies spoke highly of her and her work ethics.
Sergeant Simmons said she was more of a sister than a staff member or a subordinate to me. She was very trustworthy and confidential, very reliable. I could have called upon her at any time. She responded favorably without a frown and without asking why or for how long. She was very dedicated, a valuable asset to the telecoms department and the Royal Citizens and the Revenue Police Force. Sergeant Rodney said she wanted to make sure that everyone was happy. She did all in her powers to ensure that she achieved that objective. She gave her best